Obsessive compulsive disorder is also known as OCD, and it's one of the few mental health conditions in which medications are almost always essential symptoms to resolve. So one is considered to have obsessive compulsive disorder if they have either obsessions or compulsions. So the obsessions are typically recurring intrusive thoughts that cause a lot of distress and affect someone's functioning in life. And typically these intrusive thoughts are fears of contamination, fears of germs. It could be a variety of situations. The compulsive behaviors are typically behaviors that are learned over time, and people keep doing them because for that moment it has decreased the anxiety or tension that they feel. And so because that has decreased the anxiety or tension in that moment, they typically continue in these repetitive behaviors, in which it's difficult to stop. Oftentimes, if it's like a fear of contamination, people may be washing their hands 40, 50 times a day. Maybe they frequently check the locks to see if the doors they've locked, or they keep checking the blinds to make sure they're shut and no one looks in. And they may do this repeatedly throughout the day, and it causes some distress in their life. Some other findings in obsessive compulsive disorder is people who frequently brush their teeth, and they brush their teeth so much that their gums will bleed. They could be doing repetitive rituals such as religious rituals, such as repetitive prayers or frequent counting. Selective serotonin reuptake inhibitors can help treat obsessive compulsive disorder, but one of the most effective is fluvoxamine. Clomipramine is a type of antidepressant that is a little bit older and is not used much nowadays because of its side effect, and it can be lethal if overdosed on, but that can also be helpful for obsessive compulsive disorder. In severe cases, deep brain stimulation where electrodes are planted in a certain part of the brain can help with this disease. Also, transcranial magnetic stimulation can help with people in severe cases of OCD. Therapy techniques are typically geared to help people resist the urge to act on the feelings that they have, or act on the thoughts they have. If they have fear or anxiety about a certain situation that was learned over time, maybe those emotions are explored in therapy in hopes that over time the anxiety and the fear decrease less and less, and the obsessive thoughts or the compulsive behaviors decrease less and less, till eventually the goal is that they will be gone altogether.